I will share a little bit finding from our Malaysian healthcare supply and demand study. Little bit of acknowledgement to our Director General of Health for granting his approval to present this information, and a bit of a disclaimer that any statistics presented here are for reference only and should not be considered as the official statistics of Ministry of Health Malaysia. So ladies and gentlemen, let's start from something that we know. Malaysia is getting older. By projections, statistics says that by 2030 towards 2040, majority of the populations will go over with the age of like over 60 years old. And this is just not a statistics number. This is like a huge number of people who are seeking a quality of life. And the quality of life need to be supported by a quality health care. As our population is getting older, we are also seeing the increasing price of non-communicable diseases. Diseases such as diabetic, hypertension, and ischemic heart diseases is no longer an isolated and rare diseases among our populations. And these diseases just not affect to those who've been diagnosed with the non-communicable disease. It also affect our healthcare. We need to allocate perhaps more bed, more hospital, allocate more services and operation theatre so that we can cater to all the complications that arise from non-communicable diseases. And indeed, our healthcare, so far, they've been doing good. Our healthcare heroes has been working well. But up until one point, we can see like there will be some news saying and talking about some of our healthcare workers are fatigued. Our resource has been strained, and then we can sometimes see the news that there's a longer queue and waiting time in the healthcare facilities. It just means one thing: we need to be creative and we need out-of-box solutions. Clearly, what we have done here is something that works today, but perhaps it is not sustainable in the long time. That's why, within the Ministry of Health Malaysia, we come out with a supply and demand study. Let's talk about supply and demand, not in economic sense, but in the perspective of the healthcare. By doing supply and demand, we are able to do some mapping, the mapping of our supply to our healthcare system, the resources, the facility, the equipment, and go it against the demands of our healthcare system, those utilizations, those disease burdens, so on and so forth. By comparing those like the supply and the demand, we are able to identify the gaps. This gap is essential because when we're talking about supply and demand, it's just not about like adding more hospital or adding more resources. It's about identifying the specific area. If we put the resources into that area, it will give impactful and it will be beneficial to what we can change to our healthcare system. And then that's how the GIS analytic and big data analytic come. Because in order for us to see the trend of the diseases or to come out to see the gap and the area where we should invest, we need a platform that we're able to combine a lot of data resources. The data might come from the survey. It might come from the research data, study data. The data might come from the admin data, or even the addresses of the general practitioner taking from the web crawling. And all this data will come into the platform and will be pushed so that we can do some ETL, the transformations of the data. The data will undergo what we say as a data standardization so that it can fit into the compartmental modeling that we can come out as the data projections. And then comes GIS. We do some geocoding, GIS analytics, some network analysis, and we do some collaborative analysis between the vendor, between the researcher, so that, and then finally, we push it into IGS Enterprise where we develop operational dashboard, web app, experience builder, and the story map. So now let's come to the fun part. Let's see how GIS actually can be used for us to do resource planning. Okay, let's imagine yourself, in fact, being given a task to build a new hospital. And this new hospital need to have a cath lab. In case any of you don't know what is cath lab is like a services that we give to those who are having heart disease. This is the services that we do: angiogram, angioplasty, balloonplasty, so on, or perhaps like putting stents, so on and so forth. So basically, this is a distribution of the facility that got the cath lab. You can see like the spatially, those facility that got the cath lab is located at the center of the map. It's been spanned from the east to the west. The red one is the public facility, and the blue one is the private facility. So let's say in case mana kita nak bina hospital yang baru, so we need more data. Perhaps we overlay it with the population density. And we can see again, the distributions of the healthcare facility are located those in the high density populations. So perhaps there is certain area that also get high density populations, but not yet accessible with the cath lab services. Perhaps here, over the north part, and over the southwest, is a potential area. Perhaps we can build a new hospital there that can provide the cath lab so that the populations over there can access the cath lab services in that area. But wait a minute, let's say if we choose like this place to build a cath lab, to build a public cath lab services, but there's also private healthcare facilities there. The thing is about the supply and demand is not just about building new facilities. Perhaps instead of like building new facilities, we can do a public-private partnership. So instead of like building a new facilities, we can consider doing a public-private partnership and get the cath lab services in the private facilities to be more affordable towards the populations. Let's look another state. So basically, this is distributions of the cath lab in another state. It's located in the middle and also at the west area of the map. Let's say like if we decided this is a one high density populations, but they haven't yet got any facility that can give a cath lab facility. But there's also a private hospital over there. So perhaps instead of like building a new facility, we can ask the private facility to give an affordable cath lab services to that populations. So that's how we do planning in the healthcare resources using GIS. So perhaps the same can be applied to the human resources. This is the distributions of the nurse in one state. As you can see, the concentrations of the nurse are located in the high density population. The same spatial trend we can see as well with the private facility. But interestingly, in the public facility, there are also nurses located in the low density populations because we want the rural populations to still have access towards a healthcare facility even though there's not really high demand or high density populations. But perhaps one day, let's say there's a shortage or increased demand of nurses in the high density population. Instead of like hiring more nurses, perhaps we can relocate and redistribute those nurses in the lower density populations toward the high density populations. Let's look at the other profession. Pharmacies, for example. Again, the same distribution we can see, a lot of pharmacies located at the high density population, as well the public and the private. But interestingly, these pharmacies is not as well spread as the nurse. Because like a lot of the public healthcare pharmacies are located within the public facilities. But just in case in one day there's a long queue waiting for the medication to be dispensed, instead of like giving the medication at the public facility, perhaps we can enroll all the private retail pharmacy outside, especially those in the high density populations to dispense the medication. So instead of the patients come to the public facility to get their medication, they can take their medications in the private and retail pharmacy. So that's how GIS helps us in order to us do a decision, reallocate resources and make a better decisions. But all this knowledge, all this analytic is not meaningful if it is not accessible towards the masses, especially to those within the healthcare communities. So that's why we package it in a way so that it is understandable among the medical communities, among the healthcare planners. We provide operational dashboard so that the middle manager and the top tier stakeholder can get the eagle view or the situational analysis of what happens within the healthcare system. We also provide them with the projection so that they can know the projected needs, what is needed to the healthcare system towards like different scenario. We also provide them with a tool using Experience Builder so that the health planner, let's say they want to find or allocate resources, how they are going to find opportunity area so that they can put and better allocate their resources in order to meet the healthcare demands. And to get a better engagements and better discussions among the community, we provide to them a supply and demand resource hub. Inside here, we compile all the solutions within one site so that if they want to find the solutions in order for them to do the supply and demand analysis or resource allocations, they can look into this hub and then go find all the information packaged in the team which are understandable to them. And then within each team, we provide to them like a story, a context, a background story, so that how they can fit all their analytic and come out with the analysis. So our aim is actually to provide them a better story and a better context. Our aim is not really to give the solutions, but to incite discussion so that the people, the stakeholders who are involved in making a decision, reallocate the resources, can make a better decision in doing a betterment to our healthcare facilities. So perhaps let's continue to collaborate. Let's continue to innovate. Let's continue to make our Malaysia a nation, a healthier nation, one at a time, one dot at a time.